My name is Taylor Schenberger, and I love to smile now, and I am ready to bite into a sandwich. I first started having issues with my jaw when I was very young, at least 4 years old, so I've always had an open bite. I had braces put on to potentially help the problem when I was probably about 10 years old, and then again right after that, so I got my second pair of braces off when I was about 13. And unfortunately, it didn't do much to really help my open bite. It straightened the teeth out, but I still had a pretty good gap between my front, or my top and bottom jaw. I was told that I would have to have surgery at that point to ever fix it, and that I would have to wait until I was at least 18 years old to even consider surgery. Unfortunately, my jaw continued to get worse, and I went to a new dentist about 3 years ago or so, and the dentist said to me that my 2 back molars were really worn down. I waited another 6 months, went back again to the same dentist in 6 months, and he said, "No, really, you should really think about getting this fixed. There's this great orthodontist that you can talk to, and he works on cases like yours. People who have always been told that they will have to get surgery, he's able to do it without surgery."
Hello, I'm Dr. Yoon Chang at Line Ortho in North Dallas, Texas. Most orthodontists and physicians believe that our jaws are static in nature with little to no capacity to adapt. Therefore, in the presence of craniofacial skeletal disharmony such as underbite, excessive overbite, mandibular lateral deviation, and open bite, it is the norm to hear orthodontic jaw surgery as a treatment of choice. However, it's been proven that our jaws are not static even after growth has ceased. And contrary to the conventional wisdom, our jaws are very responsive to the environment. For example, in an individual with open bite, it is common to find a shorter height on the mandible, which produces a backward rotation of the jaw, and in turn producing an open bite. And this will not only affect the facial morphology from achieving a full genetic potential, but also affects all aspects of the masticatory organ functions.
I realized that I did have a lot of fatigue in my jaw and that it wasn't normal. I wasn't opening my jaw all the way. I thought I was, and then they pointed out that it was very limited. I remember marking down X's on a questionnaire where I felt pain on a regular basis, and I was getting like headaches that would come up seemingly from my neck or from my jaw and like spreading. I had neck pain. I think I marked lower back pain. So Dr. Chang was one of the first people to say, like, you don't have to live with this, and we can do something about it. So I pulled the trigger right away. I think I had dragged my feet for so long before that and lived with it for so long that when I finally found a solution, I was ready to hop in and do it.
Through craniomandibular orthodontics using multi-loop H-wise arch wire and gunmetal H-wise arch wire orthodontic technique, it is possible to move teeth beyond the limits of traditional or conventional straight wire orthodontic. Once the upper arch is widened to fit the lower arch, we can move the lower molars down or sink into the bone. That will free the mandible to move forward and up, creating not only closure of the open bite, but also a drastic change in the facial morphology as well as the functions related to the masticatory organ. Before having orthodontics, craniomandibular orthodontic treatment, and after having the treatment done. A drastic improvement on the profile. The lower jaw not only moved forward but went up.
I was living a pretty sedentary lifestyle, and the braces had helped with some of the pain in my facial area. For instance, I would get really sore right here, and I don't even know if it was 6 months into the process and that was completely gone. So I was like, let's keep improving, let's work on, you know, my overall spine, my overall alignment, and I did posture therapy, and that only continued to add to how much better I felt. Did chiropractic care, got regular adjustments, to the point where now I really don't have any of the same pain that I felt before. I feel like a completely different person than who I was when I first came here. I can actually bite into pizza now, I can eat sandwiches now, and I actually just got my saxophone tuned up, but I haven't played it for like 8 years. I just took a job where I'll be speaking a lot and teaching again, and it's the first time I've done that since I got braces on, so I'm really looking forward to being able to talk to high schoolers all day. Braces is not an easy journey, and there are challenges, but it was worth every penny that I spent, every moment I spent in the office, and every moment I spent cleaning out my braces. It was worth it. If you're ready to eat pizza again or bite into a sandwich without pain, without embarrassment, come see Dr. Chang.
Welcome to Line Orthodontics. Dr. Chang follows a holistic and integrative view between your bite and your body, creating a functional and beautiful smile. Are you ready for a better smile? Call Line Orthodontics.
Hello, my name is Roberto Velasquez. I'm from Cartagena, Colombia. This seminar I try to explain a very special technique that I learned in Japan from very famous Professor Sadao Sato. In this special technique, we try to avoid surgical intervention, especially in very severe for example, class 3 open bite, class 2 open bite, and class 1 open bite cases. And we try to share our knowledge to all the students and try to learn them how to treat all these cases without any surgical intervention. We try to explain step by step how to bend a very special wire called gunmetal. This is a very special alloy developed in Japan with the unique characteristic, and then we can apply to the correction in any type of malocclusion. So I would like to invite to everybody to join us to try to learn this very interesting technique in order to prevent the surgical intervention in all our patients.
Do you expect to wait longer for that bony growth in that area?
Of course.
So
Even
more like
without-
5 years or?
Yes, quickly.
My name is Christina Herrera. I'm a general dentist. I'm practicing in Los Gatos, California. I've been studying the meow technique for several years. I use it to treat those hard to treat patients, the class 2s, the class 3 open bites, particularly the open bites. It makes these patients very easy to treat. This seminar was a really great next step. Dr. Velasquez showed many of these very difficult patients being treated in a year and sometimes less. The information I learned in this seminar was well worth the time that I spent away from my practice. I feel that I'll be able to use this information going forward and be able to treat my patients much more efficiently and effectively. I would recommend this course to any general dentist or orthodontist who's interested in occlusion and function.
I remember I would try a bite on a hamburger or a sandwich or even a little grape. I couldn't bite from the front. I had to move it to the side. Always having indigestion problem. Looking at my pictures from the side, and my profile picture will be, the front, it just looks very protruded on my mouth, and I did not know that it was because of my bite. I went to a few orthodontic before Dr. Chang, and all three of them suggested that I needed a jaw surgery. And the way that they had explained to me was they need to open up my side, the jaw, and they shaved a part of my jaw. And just hearing that, I didn't want to continue to do it anymore. And my dentist had actually recommended Dr. Chang to me, and she told me that he's an expert in correcting open bite. And he told me that he could correct my open bite and without any surgery, and I was on board with it from day one.
This is another example of an open bite. The lower jaw has adapted backward and up, creating open bite. In this patient in particular, it is noticeable to see how the face deviates to the left while she's standing or smiling. Multi-loop H-wise arch wire technique and the gum metal H-wise arch wire technique, it is possible to intrude or sink these molars inside the bone, freeing the mandible to move up and forward. Our jaw wants to go forward and up, but the molars are the ones that limits that, or the slow adaptation that the patient went through is the limiting factor. Once the molars are out, the jaw continues forward, and we can achieve closure of the anterior open bite. And we spend a lot of time detailing and making sure that when the jaw moves side to side, we may achieve a good guidance system. The result of this treatment not only translates into improvement in the facial profile, but also a change in the body posture. We can see how her neck positions differently. Before, used to be tilted torso left, and now she may stand straighter.
So after I've had my braces taken off, it's a completely different life. I'm able to pose more in front of camera, and I can smile more, and I have more confidence, and you feel like you can conquer the world. Is that too much? My name is Sainer Ramsey, and I am more confident in my smile than I have ever been.
Welcome to Line Orthodontics. Dr. Chang follows a holistic and integrative view between your bite and your body, creating a functional and beautiful smile. Are you ready for a better smile? Call Line Orthodontics.
주걱턱은 항상 수술하라고 하잖아요. 제가 어떻게 묘 교정돼서 배웠냐면 한 주에 제가 상담을 2번 받았는데 둘 다 주걱턱 있는 환자였어요. 두 분 다 제가 수술해야 됩니다 하고 말을 했는데 그 말을 하고 나서 너무 좀 그렇더라고요. 어떻게 무슨 방법이 없을까? 그때부터 이제 찾아보고 금방 제일 위에 나오는 이름이 사다오 사토였어요. 그분은 이제 수술 안 하고 이제 교정을 한다.
Hi, this is Neil Abdallah, and I just like my new smile. When people were looking at me and I was just hiding my mouth all the time, and the less you talk is better because I don't want anybody to see my smile. Right now, people are like, dude, you're talking way too much now. It's not like you used to be before. My mouth was a little bit crooked, it was acceptable. But over the years and all the time, it's not like doing maintenance the way it's supposed to be, and a few teeth that I was missing, so my mouth got worse and worse and worse. It got to the point that it was very ugly. It was very crooked, the bite was crooked, the mouth was crooked. It got to the point that it made me feel bad about it when I was talking to somebody. And I got to my regular dentist. She was like, why you have your mouth like this? I mean, why don't you do a little change? And that's what I told the doctor. This is something that I was looking to do. Like, I recommend you, Dr. Shin. And that was the day that I changed my life.
Hello, I'm Dr. Yoon Chang at Line Orthodontics in North Dallas, Texas. Most orthodontists and physicians believe that our jaws are static in nature with little to no capacity to adapt. Therefore, in the presence of craniofacial skeletal disharmony such as underbite, excessive overbite, open bite, and mandibular lateral deviation, it is common to hear orthodontic jaw surgery in combination with orthodontics as a treatment of choice. However, it's been proven that our jaws are not static, and even after growth has ceased, our jaws are very receptive to the environment. For example, in a patient, individual with an underbite condition, it is common to find a shorter lower facial height. In other words, the distance between the base of the nose and the chin being slightly shorter. The presence of underbite not only affects the facial morphology as well as the self-esteem, but it affects all aspects of the masticatory organ function, including breathing, body posture, chewing efficiency, and more. Through craniomandibular orthodontic using multi-loop edgewise archwire and gunmetal edgewise archwire orthodontic technique, it is possible to move teeth beyond the limits of conventional orthodontics and taking full advantage of the adapted compensatory capacity embedded in all living organisms. Once the upper arch has been enlarged or widened enough to fit the lower arch, it is possible to elongate the bicuspids. You can see in this view how these bicuspids are not touching the lower, and slowly we are able to elongate these teeth on the side using elastics and wire bendings so that the bicuspids are touching each other. Once the bicuspids are touching, now we are elongate the molars so they are in contact, and finally we have to detail the anterior teeth. This is a pre and post orthodontic treatment comparison of this patient. Before orthodontics, the patient was an underbite, so-called class 3 skeletal relationship, and after orthodontics, the patient has achieved a class 1 relationship. If we compare the profile tracing, you can see that before orthodontics, the lower lip is positioned forward compared to the upper. However, after orthodontics has been completed, upper and lower lip are at the same level. If we superimpose both images, you can clearly see how the chin had gone back as well as the lower lip. This is a frontal view of the patient before and after orthodontics.
I have a company called RNW. It's a logistics service that we do a delivery from Best Buy. We're the one that are making all delivery for appliances, like all the washers and dryers, refrigerators, everything built-in. That's the one our company come to your house and do it. When I walk into these people houses, we meet 50 people, 60 people a day. I got some people that looking at me, and when I see my smile, they will say, well, dude, you got a beautiful smile. And then going back what it was before, I was put my hand in my mouth for the people not to see my mouth, and now people saying that you have a beautiful smile. I mean, like I like your smile, and you got a beautiful teeth. It make me feel like it was a big trophy for myself. You can do it. That's all I can tell you. I mean, just feel good yourself, and you can change your life. Hi, this is Neil Abdallah. I'm very happy with my smile. Thank you very much, and have a wonderful day.
Welcome to Line Orthodontics. Dr. Chang follows a holistic and integrative view between your bite and your body, creating a functional and beautiful smile. Are you ready for a better smile? Call Line Orthodontics.